So the case is Maya is a 13 years old girl, has been complaining from recurrent headache since 8 months. This headache is causing school absence, but previously she had good school performance. And she's growing in the 75th centile for weight and 50th centile for height. She is referred from her GP regarding her complaint. Initial assessment in the referral shows normal CBC and normal kidney function tests. Take the focused history from her mother, Mrs. Amina. You want me?
Okay, weight on 50th and height 75th. School absence since 8 months. Maya, 13-year-old, referred from GP with a history of recurrent headache, right?
Wait.
Normal CBC and KF2.
Weight is 75th. Weight is 75th. Height is 50th.
75th. Okay.
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 And
Yeah.
yes, she is 13 years old girl complaining of recurrent headaches from 8 months. There is school absence due to this, but the school performance is good. And this is the growth I told you, 75th in weight and 50th in height. And GP referred this case, and she has normal CBC and kidney function tests.
Okay. Okay.
And mother name is Amina, and child's name is Maya. Okay.
But I need to take the history from Amina, right?
Amina, yes. Okay, 4 minutes for you now, okay? Or even 3 minutes.
Yes,
If you're
yes.
ready, tell me. At least 3 minutes. Okay, you can start.
Yeah. Hello, Mrs. Amina. I'm Dr. Krishna, one of the pediatric registrar working in the hospital. I believe I'm talking to Amina, mother of Maya.
Yes, doctor, this is me.
Yeah, nice to meet you. I'm here today to take some notes for the complaints of Maya's condition. As GP letter has revealed that Maya is having headache since 8 months. I want to know more about this headache. So is this the right time?
Yes, doctor, you can go ahead. Even I am worried about her headache.
Yeah. So can you please describe the headache for me, Mrs. Amina?
This headache comes to her in this 8 months, every 2 times per month. And whenever it comes, she feels like she wants to stay alone, not communicating with anyone. And this is my worry, why she has such a bad headache.
Okay. So can you please, whether there is any associated factor, like whether there is any vision problem associated, whether she's complaining of any other associated like tingling or lightning of in front of eyes like this before headache?
Yes, sometimes she complains that she sees some flashes of light before headache. Yes.
Okay. Can you please describe the site of headache for me, where it is, like in the back of the head, front of the head, or whether it's one side or both the sides are affected of the head?
Actually, it is one-sided. Usually, it is one-sided on the right side.
Okay. Is it awaking her from her sleep?
No, she's sleeping well. Usually, her headache is coming only during the day.
Okay. This headache since 8 months, is it increasing, decreasing, or static in terms of severity and frequency?
No, it is not increasing. It is the same presentation she has from the 8 months.
Okay, so when it started, it's the same, and now also it is the same.
Yes.
Okay. Can you please describe the headache? Like what type of, describe the character of headache for me? Like whether it's throbbing or it's fizzing like a band, or stabbing?
She says that she actually did not tell me what exactly she feels, but
Okay.
whenever she has this headache, she avoids the
Mhm.
noises. If somebody is making noise, she gets very
Okay.
much angry. She gets into the
Mhm.
room, closes the door, offs the light, and stays alone. This is what I have seen, but
Okay.
never she told me
Okay.
how it looks for her.
So it has a she wants to stay in a dark room, right?
Yes.
And these episode, does it gets relieved on its own, or she needs any medication for it?
First, see, I don't like medications actually, so I was not giving her medication in the initial months. So she used to
Mhm.
have lots of problem for 5 to 6 hours, 7 to 8 hours not relieved. So then I give her paracetamol for
Mhm.
2 months in her during her attack, but I did not see much benefit. So then I gave her
Mhm.
ibuprofen. I
Mhm.
feel that there is some benefit, but still she
Mhm.
has the pain. She has
Okay.
2 episodes per month.
Okay. Okay. And does this pain radiate to anywhere, like to the is it affecting one half of the head, and that's all, like the whole half? And does it is radiating to other half as well?
No, no, no. It is not. She's just
Okay.
complaining on one side.
Okay. And what about the duration? Like how much time does it last, this headache?
5 to 6 hours.
5 to 6 hours. So, and it is throughout, like 2 times per month from the beginning, it's the same.
Yes, yes. It is same and same time also.
Okay. Which time usually?
Usually, as I said, it will be during the daytime, not the night.
Okay. During the daytime means early morning, or during the school times when
Uh,
she's in the school?
uh, no, like between 10 to 3 p.m. or 5 p.m. like this.
Okay. Okay. And is there any exacerbating factor, like when she's coughing or bending forward, or when she's exposed to light, or when she's doing excessive exercise, or particular type of food, when she's having caffeine, suppose, or chocolate or cheese? Is there any exacerbating factor for her?
No, 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 for no, nothing. Chocolates, caffeine, and cheese. She has no problem with it.
Okay. Does this pain relieved is exacerbated by sleep deprived, when she gets deprived by the sleep, when she doesn't sleep well, and the next day she feel the pain more? Is it exacerbated by that?
No, she sleeps well. She has no problem with the
Okay.
sleep. Only during the day this
Okay.
is coming.
Okay. During the headache, can you please describe her appearance and behavior? Like, is she having pallor or
As I
something?
told you, during the headache, she doesn't want to speak to her siblings or play with the siblings. If they
Mm-hmm.
are making noise, she will be angry. She will get into the room and sit there without the light.
Okay. Okay.
What
And
she
is there
does.
any Okay. And is there anything she feels before headache?
As I told you, there is some. She says that she sometimes sees the flashes of light.
Okay. Okay. Fine. So, and what about whether she's having any vomiting or abdominal pain,
No vomiting, no abdominal pain. But she has the
constipation?
sensation of nausea.
Okay. When associated with the headache.
Yes.
Okay. Any loss of consciousness or
No,
convulsion?
no loss of
Any
consciousness,
weak,
no convulsion,
any weakness?
no weakness.
Any concern with vision or hearing?
No, no, no. Only when she has pain, only she has these flashes of light. Otherwise, she sees well. She's not using any spectacles.
Okay, but school performance is good, but school absenteeism has increased, right?
Yes, school performance is good, but absence is increased.
Increased. Okay. Can you tell me the regarding is it associated with any fever or night sweat?
No fever.
Okay. Cough, shortness of breath, ear
No,
pain,
no,
toothache.
no,
Okay. Any skin spot, joint pain or swelling in the joints?
no,
Any increase in heart rate, heartbeat? She feels
no,
or a change in color of lips or episode of fainting attacks?
no, no. I have never come across this.
And any concern regarding pee or poo?
No, she's doing it fine.
Okay. Any previous admission?
9 minutes now, 4 minutes left.
Okay.
Okay, go
Any
ahead.
previous admission?
No,
Any previous admission?
no,
No. Any history of trauma?
no, no, no.
Any she's on any medication?
She's, as I told you, only this ibuprofen. Presently, she's only on ibuprofen.
Okay. Any team involved for her?
No, no, she's not. She was just, we were just going all these days to GP thinking that this is a simple headache. Now, because I feel that I am not happy. It's now 8 months. I want some imaging for her head. I want to check what's happening with her. That's why I
Okay. Any
asked my GP to refer to you.
okay, fine. Yeah. Any investigation done? Oh, sorry.
No,
Any no
yeah, yeah.
investigation. Operation.
My GP did some blood tests and he said it's normal.
Okay, fine. That's nice. So any operation or admission in the past?
No operations, no admissions.
What about the birth? Do you have any concern with the birth
No,
of
no, she
the, was
had
it not?
no, she had normal delivery and no concerns. Her childhood was very good.
Okay. What about her diet? Is she taking adequate diet?
Yes, yes, yes. She's taking everything like normal.
Is she a fuzzy eater?
No, no, she's not a fuzzy eater.
Okay. What about the shots? Has she received all the shots?
Yes, yes, she has done all the shots.
And any extra shots?
No, no, no extra shots.
Not. What about the scholastic performance? You said it's perfectly fine.
School
Just
performance
absenteeism
is
has in.
good.
Yeah.
Yes.
Okay. Okay. Fine. What about the family history? The similar
Yes.
complaint in the family.
Yeah, yeah. Her aunt, my sister, has this one-sided headache, what we call as migraine, and
Okay.
she's on some medications which I don't know.
Okay. How your this condition is affecting your family?
Yes, actually, it is affecting a lot. I am a working lady. Sometimes I will not be available at home, and she starts this headache, and my children will call me, and I have to leave the job and come to attend her. There is a huge impact on our family.
Okay. Does she face any bullying at school?
As such, no bullying, but she has joined a new secondary school. She's doing fine with the school. Only thing is she's absent sometimes because of this headache. The school will call us and we will be going to them.
Any stressful event, any stressful event in the school or family?
No stressful events. She's a good student. She only wants to be first in the class. She will be striving hard. That's it. Otherwise, as such, she has no stress.
Okay. What about, do you receive any social help, social services help?
No, no, no.
Does anyone smoke at home?
No smoking.
Okay. Any sibling? Do you have any other sibling?
Yes, yes, she has three. They are three, and
They are
she's the
fine.
eldest one.
They
Time
are
up.
fine. They're fine.
Yeah, they are fine. Time finish, huh?
Okay, okay. I could not finish on time actually.
3
Okay,
minutes now.
fine.
Okay, fine. Let's go to your history. So you will present the case now, okay?
Yeah, Maya, she's 13-year-old. I took history from her mother, Amina. She's having headache, which is one-sided and is associated with photophobia around 2 times per month. She's complaining of headache since 8 months, and it is associated with a school absenteeism. But the school performance is good. Otherwise, she's growing well, and was referred with a normal investigation from GP, CBC, and KFT. On the top of my differential diagnosis, I would put migraine.
Okay.
Yeah.
Okay, give another other if you
It can be tension headache, but it is unilateral, and there is it is lasting for hours, 8 hours, and during the daytime. So the diagnosis of tension headache I could not make. It can be a brain tumor, but she's growing well for his age, and otherwise she's well, apart from except this 8 hours of headache. She's apparently well, and her investigations are also normal. So I would not consider a brain tumor.
okay.
I would like to do complete this ENT examination, and would like to have her blood pressure, visual field. I would like to have a fundoscopy and the visual field examination done.
Wait. Before that, in your presentation, I think you did not tell about the social history, right? Social and family history. Did you tell?
Yeah, I could. No. I could not take the complete social. She's not receiving any social support. There is a family history of aunt with a similar
Yeah.
complaint.
When you are presenting, you should tell this also. You missed this. Her aunt has migraine, and there is a huge impact of the family because it is affecting the work of the mother and also the child. There is school absence. Okay.
Yes.
Otherwise, you
Yes.
asked, almost you covered. You asked about the social support. I said no, and finance also in a different way. You asked like you are in need of help. So we said no.
Yeah.
But
Yeah.
clearly you can ask any financial support is needed for you like this. Okay.
Yeah. Ideally, I would have asked for 4F, 4S, 2P. I could not ask for like the family finance, then furniture, then friends, social, smoking, then school, sibling, and pet, and plan of emergency. These things I could have asked like in detail. But yeah, I tried to cover most of them. Yeah.
Yeah, you try to cover, but see what your list for the social, it again depends upon the history, what history you're taking.
Yes.
In this history, the main is the impact and the finance, and also since she's 13 years, can also take about smoking, alcohol, any drugs.
Yeah, and most important, I didn't get time to ask about head, like pubertal, like for she's a pubertal girl. So I could have asked about education, sports activity, drugs, smoking, alcohol, drug. I could not ask that, like, because of the short of time.
Okay.
Yeah.
Okay, now let's first complete and then we will discuss that. So you said your differential diagnosis is migraine, tension headache, but less likely, and also brain tumor, less likely. So how you want to proceed with this patient now?
I would like to reassure first the family and Maya as well. If there is any like, I would like to first advise to, if there is any lifestyle modification needed, I would like to do that. And I would like to capture some, if there is any exacerbating factor from the history I could not go through it, then I would like to do complete ENT examination. I would like to have the complete vitals. I would like to have head circumference, visual field, fundoscopy. CBC I have already. RFT is normal. Then I would like to have urine analysis for nephritic glomerulonephritis. Then, if needed, I would, but this imaging is not indicated. So I
Why
would
you
like
want to
to,
go for why you want to go for glomerulonephritis here?
I would like to exclude with the urine routine.
Okay, okay, no problem. Urine as routine, but if you mention glomerulonephritis, maybe they will. Is it related
Okay.
with the migraine? No, right?
No.
Yeah, so better
So,
don't tell. Okay,
uh-huh.
okay. See,
Uh,
then
I would like to have start with the triptans, with the sumatriptans. Then
no, mother told you that she needs imaging. Do you want to do imaging for this child?
no, actually not. I
How
would
do you
not like
convince
to.
the mother? What do you tell her?
I would say, like, though MRI has no radiation exposure as such, but it is very traumatic for the child to go into the machine, and they can, again, it is not easy investigation. It is unnecessary, and it is not needed. It will be worrisome for the child to go into that machine, and then again, and it's not indicated also, though it has no, if mother says like, there is no, I read that MRI has no radiation exposure, I will convince like this, like, yeah, you are right, but this is traumatic for the child and it's not needed.
Okay, so you will not go with the imaging for this child.
No, no.
So what is the management you will give to the mother now?
This I told you, like, first of all, non-pharmacological, and like the lifestyle modification and all. I will see whether there is an exacerbating factor or for the child. Then I rule out that. If it is getting corrected with that, I would not go with the drug treatment. If it's needed, I would start with the relievers like triptans, sumatriptans.
Okay. Any
And
okay.
she doesn't need any prophylaxis, like she's having two times per month, so I would like to give the relievers like sumatriptans, like this.
Okay. Okay, I think it was fine. But only can you do your presentation again so that we will see, including the family history and social, whatever social
No.
history able to
Yeah,
complete, including family history.
yeah,
And
yeah, yeah,
we do the
yeah, yeah,
presentation again.
yeah,
Wait,
yeah,
wait, I
Maya.
will check. Wait 1 minute. I will keep the timer for you to see how